Do you or someone you know have pain in your joints or stiffness when doing daily activities? These symptoms may be related to a common condition called osteoarthritis. It affects more than 32 million adults in the US. Now, joining us now to discuss this and how physical therapy can treat and help people manage the symptoms is physical therapist Dr. Sherry Betts. Dr. Betts, how are you?
I'm great. Thank you for having me.
It's a pleasure. Now, what is osteoarthritis and what are some of the common signs and symptoms that people need to look out for?
Osteoarthritis is a condition that results in degeneration or wear and tear at the joint between two bones in the cartilage or the cushion that provides that shock absorption to the joint. It often affects the hips, the knees, the hands, and the feet.
What
the symptoms that someone might feel are pain in the joint, stiffness in the joint, especially in the morning when they wake up, and creaking or cracking in the joint known as crepitus.
So
we
what
often...
I'm
yeah,
sorry.
So sorry.
I just wanted to know, like, what are some of the common myths regarding what people with osteoarthritis can and can't do?
Yeah, some of the main things that people avoid are the very things that they should be doing. They can start with low impact activities if they have a lot of pain. They can start in water, doing supportive water therapy or swimming, progressing to cycling, and then progressing to land-based exercises gradually over time. And then they can also start thinking about doing strength training. And that's something that people often avoid. But strength training will provide that shock absorption and cushion around the joint to give it a lot more support and reduce their pain.
Physical therapy is obviously very important in a number of different aspects of recovery, but how do physical therapists treat and help people manage the symptoms of osteoarthritis?
Well, the first thing that a physical therapist will do is provide a comprehensive physical assessment from head to toe. They'll look at the way a person is weight bearing on their feet. They'll look at their gait, their movement, their range of motion, their posture, even providing information about selecting shoes to reduce some of the forces on those arthritic joints. This can help to eliminate the need for steroid injections or surgery. I have a patient that is suffering from osteoarthritis of the knee for several years. And after just a few weeks of treatment, she achieved her goal of climbing those 135 Spanish steps in Rome on a vacation with her family after receiving physical therapy.
That shows the benefits of physical therapy, but why is it that physical therapy is as effective and in some cases even more effective than something, say, like a steroid injection for knee osteoarthritis?
Yes, we know that about 12.4 million people over age 65 have knee osteoarthritis, and some people elect to receive multiple steroid injections. In fact, a new report by the American Physical Therapy Association compared physical therapy to steroid injections and found that physical therapy was actually more effective and also saved $14,000 per episode of care. Another factor in considering steroids versus physical therapy is that steroids actually reduce bone density and can weaken tissues around the injected site. So it makes one more at risk for tendon injuries and bone loss.
Is physical therapy tailored to the specific client? Is it a case-by-case basis?
Absolutely. Every single person with osteoarthritis presents differently. Some people may have weakness in their calves. Some people may have core control weakness. Some people may have gait disturbances or malalignment of the lower extremities that are leading to problems with that joint. And your physical therapist can evaluate that and find out what are some of those contributing factors and help the person overcome them.
Dr. Betts, that's great information. Thank you so much for your time. To learn more, go to choosept.com.